Hi, this is Ben Trump, and I am doing this presentation on the topic of highly educated nurses and the higher quality of care that is delivered by one who has a higher education. We have some objectives to go over here, so by the end of this presentation, it will be expected that the learner will be able to explain the relation of higher education to higher quality of care and outcomes for patients, that the learner will be able to understand the driving forces behind this push for higher education in nursing practice, and then also be able to list several examples of nursing or healthcare related metrics which are improved with one's higher education and or degree. So we got here with this big sort of proponent for push. All of us in this class are aware of the need for us to obtain a BSN degree by 2020, and this all transpired because of an Institute of Medicine report that was published in 2011 showing that in order to be able to care for the increased health care needs, complex care needs of patients in the 21st century, that nurses need to be achieving higher levels of education so that they can both be and feel more prepared to meet those complex care needs of the population. And as we have been learning through this BSN degree, there's a lot of things that go into it. There's information and education on leadership, on the importance of evidence-based care and research behind the care that we perform, of system improvements, of the needed and necessary collaboration and teamwork that goes through and among the multi-dimensional care needs of nurses and how they interact with health professionals and patients. This slide is just a quick way to look at how BSN degree programs and degrees have increased over the past 20 to 30 years, and how diploma and even associate degree programs have sort of shrunk to an extent. So the specific nature of this is it's important that it impacts healthcare because there's a few studies that have actually shown metrics that BSN prepared nurses have better outcomes. In a study completed by Aitken et al. In 2003, there was this revealment that BSN degree nurses had increased safety behaviors in problem solving, in performance of complex functions as it relates to patients' care, and also in the effective communication both among nurses to patients, nurses to nurses, and then even nurses to physicians. Yakusheva et al. In a study performed in 2014 found that for every 10% increase in BSN prepared nurses, there's a 5% decrease in mortality. And the goal is to sort of, once you get up to an 80% prepared workforce of BSN degree nurses, there's not much more improvement. That's sort of like, it's capped there. After 80% working to 90 or 100%, there's not much more improvements to that. So that's why this goal is for the push of 80% nurses to be BSN certified. And then in the last article here, we have Bledgen et al. Performing a research study in 2013 in the Journal of Nursing Administration, showing that higher education leads to decrease in patient adverse events, specifically in the realms of heart failure mortality, hospital-associated pressure wounds, failure to rescue events, i.e. not understanding or realizing a decline in a patient's condition, and then our DVT prophylaxis, PE prophylaxis post-op, and then also helping to decrease our length of stay. It is interesting to note, though, that of most of the studies performed, specifically Backhouse et al. In 2017 actually revealed that these clinical improvements are only applicable to the acute care setting, where extended care facilities actually have no evidence that there is a relationship between higher education as it relates to a BSN degree. And most of that is because of the small and very short amount of care that BSN prepared nurses prepare in the everyday hands-on tasks. So why does this is important for society too? Because we have seen that as it relates to healthcare, our clinical outcomes are going to be improved. As clinical outcomes are improved, we're going to lead our patients to experience a longer life and then also better quality of life. And there's also this component of an aging workforce too. 55% of nurses are 50 years old or older, and there's about 1 million nurses who will be reaching retirement in 10 to 15 years. So this is a huge tax on the system where there are some people who are older than 50 or 55 and they're just simply not going to get their BSN degree. That's going to potentially cause a shortage of nurses who need to fill those realms. But on the positive standpoint, there's going to be this bridging in this healthcare gap too. Lathrop and Hodnicki in 2014 draw the correlation that these BSN prepared nurses are going to be able to continue their education to reach that master's or doctorate level nursing so that they can become those advanced practice type nurses. So in conclusion, we see that higher education helps to improve clinical outcomes, which for our patients lead to better quality of life and longer life. Our higher education is needed to meet these increasing complex healthcare needs of society. And specifically, bachelor's prepared nurses helps to improve a variety of safety measures and outcomes as it relates to the heart failure mortality, healthcare associated pressure wounds, the lack of recognition of failure to rescue events, and the even increased safety behaviors. So I just want to thank you for taking the time to look at my presentation, and hopefully you can take away some positive things from this. Thank you.